Good afternoon, our honorable speakers and attendees. Welcome to the second IARH technical webinar in 2025, hosted by the WHO Country Office Myanmar. My name is Dr. Shinet Nyangwe, and from the WHO Country Office Myanmar, I'm very honored to be served as the moderator of the today event. As you are aware, our focus today is on the WHO key recommended maternal and newborn health commodities and emergency IMNCH kits. Today's event is jointly organized by the IMNCH team and health cluster team of the WHO Country Office Myanmar and kindly supported by the honorable speakers from our WHO headquarters and regional offices of the UNICEF and UNFPA. Unlike our previous webinars, this webinar is intended to the health cluster partners, UN partners, WHO implementing partners, and all the health organizations in Myanmar. Dear participants, we have shared a Google form in the message box. We will share a form, and if you haven't registered yet, please take a moment to do so. If you are already registered before the webinar, you do not need to register again. Next slide, please. For the agenda items of today, we have 5 presentations from our honorable speakers. The first speaker of today will be Dr. Edgardo Abalos, and he will kindly share us the WHO recommended maternal and newborn health commodities. Then Ms. Sacha Bootsma will present the overview of the Interagency emergency health kits. Our third agenda will be the Interagency emergency reproductive health kits, which will be delivered by the Dr. Tomoko Kurokawa. Our fourth agenda items will be jointly presented by 2 honorable speakers from the UNICEF, Dr. Shaimaa, Ibrahim, and Madam Louise Enevoldsen. It will be about the Interagency emergency health kit for the newborns. As the fifth and last speaker, we have Dr. Nimilni Hemantchandra. Dr. Nimilni will present the overview of WHO pediatric SEM kits. Now, kindly let me move to the main tenor of the today's session. The first session will be delivered by Dr. Edgardo Abalos. Before inviting him, I would like to introduce you a brief biography of him. Next slide, please. Dr. is the WHO MCH consultant and is an obstetrician working as invited researcher at Center of Studies of State and Society in Argentina. He coordinates the Sexual and Reproductive Health Observatory of Argentina and served as the deputy director and researcher at the Collaborating Center of Maternal and Child Health for 22 years. He performs his clinical practice as head of obstetric department at Maternity Martin, Secretary of Public Health, Rosario, Argentina. Dear Doctor, the floor is yours now. Thank you.
Thank you very much, and thank you for kindly inviting me to participate in this very important webinar. I will share my screen. Can you see my screen?
Yes, we can hear you. We can see and hear you in the presentation. Well, thank you.
Thank you very much. So why commodities have the potential to be a game changer if implemented within a functioning health system? In 2010, the United Nations Secretary General Global Strategy for Women and Children Health drew the attention of the global community to the lack of timely attention of access to proven life-saving commodities, commodities defined as medicine, medical devices, health supplies that could effectively address the major preventable causes of death during pregnancy, childbirth, and childhood. More recently, the Goalkeeper report from the Bill and Melinda Gates Foundation estimated that life-saving commodities could prevent an additional 2 million deaths by year 2030. 2 years later, in September 2012, and with a strong focus in the reproductive, maternal, newborn, and child health continuum of care, the UN Commission of Life-Saving Commodities for Women and Children endorsed a list of 13 overlooked life-saving commodities that, if more widely accessed and properly used, could save the lives of millions of women and children worldwide. In this list, you can see that 3 of them are related to maternal health and 4 to newborn health. Since then, the number of potentially life-saving commodities, particularly those related to maternal and newborn health, has amazingly increased, as WHO have made additional recommendations for effective intervention involving commodities that have an impact in the major causes of severe morbidity and mortality for both mother and babies. So in May 2022, the WHO Strategic and Technical Advisory Group of experts of maternal and newborn health and adolescent health, the STAGE group, recommended to conform a working group to identify those new life-saving commodities for maternal and neonatal health recommended in or published in WHO recommendations to develop an implementation strategy for scaling up those WHO recommended commodities as part of the health system strengthening. So after that meeting, we started a series of activities that happily finish in the list I am presented now. So in early 2023, a mapping exercise was conducted just to identify, we review all WHO recommendations related to maternal, to maternal and child health, and we extracted from these recommendations the commodities involved. All the recommendations that involve a commodity, and this recommendation could have an impact in the major causes of maternal and neonatal severe morbidity or mortality, were extracted. And these were extracted from WHO guidelines. Apart from this mapping, a stakeholder mapping was conducted with stakeholders involved in clinical, epidemiological, implementation research related to scaling up of MNH commodities, particularly in low and middle income countries. From this mapping of stakeholders, a group was invited to participate in this working group, and also this list was used also as a basis for the upcoming of the parallel survey and for the meeting that was conducted during this year. So in parallel, a survey focused on especially in maternal commodities, availability and barriers to access was conducted at country, regional, and national levels, receiving responses for more than 130 participants representing the 6 WHO regions with a variety of organization types, including health authorities, hospital, academia, consultants, funders, and intergovernmental organizations. And with all these pieces, we organized at the end of 2023 a technical convening meeting in which more than 100 participants in persons were reunited in Geneva and to hear their feedback from the key list of these commodities were firstly selected, and to reach a consensus for this final list. There were again a broad representation from stakeholders and experts in the field, with participation from the academia, clinician, program and procurement specialists, professional associations, development partners, donors, and UN agencies such as UNFPA, UNICEF, UNITAID, and WHO. So in this meeting, the participant emphasizes that this is not only the availability, it's not sufficient that the commodities would be available. They have to be a quality commodity, quality assured commodity, and delivered in the right way at the right time as part of the package of care. So after this convening, then internal discussions of revision of the final list, and then was another round via email with the advanced draft. And finally, in April 2024, we have this product, which is the list of maternal health commodities and newborn health commodities that we are presenting now. So this list contains 29 key maternal commodities and 34 neonatal health commodities. As you can see, this document provides a simplified list. Is in an overview of all the commodities. They are listed in alphabetical order, and you can see include drugs, medical devices, and diagnostics, and which have an impact in maternal health outcomes, and also in the case of the maternal health commodities, those commodities that apply to the mother could have an impact on fetal and or neonatal health. So you have commodities such as uterotonics, aspirin, calcium, to decrease the morbidity and mortality in the mothers, but also corticosteroids, vaccines, etc., that would have an impact in the fetus and the neonate if applied to the mother. So, for newborn health, you also have the list of key and enabling commodities. These commodities are linked to the small and sick newborn care that are necessary to manage the three major cases of neonatal mortality, which are particularly prematurity, asphyxia, and sepsis. Again, these include drugs such as caffeine and antibiotics, vaccines, devices such as breast pump or bubble CPAP, and diagnostic devices such as pulse oximeter, etc. And also in this list, they are mentioned those enabling commodities that are necessary for the health system, for the institutions to provide care. So in this first simplified list that is in alphabetical order, we also produce another different user-friendly formats. For example, you can see in the left part of the slide, those commodities linked with the major causes of maternal death. This is in this donut, in this cake, you have the global causes of maternal death, in purple abortion, in pink postpartum hemorrhage, infections, and in yellow hypertensive disorders. And all the commodities linked to reduce these severe morbidity and mortality causes. So you can see in gray the indirect causes of death are not included, so we haven't listed the commodities related to the indirect causes because WHO is in the process of updating or creating the guidelines for tackling with indirect causes of maternal death. And in the center, so you can see the commodities that apply to the mother could have an impact on fetal or neonatal death, like corticosteroid, fetal Doppler for fetal health monitoring, etc. In the middle, you have for both maternal and newborn health commodities, another format of the same commodities, but you have the link, the reference with the exact WHO recommendation for each identification. So for each commodities, you have in brackets the reference for that linked to the WHO recommendations, the presentation and the way that EML is available, this commodity in the EML, the indication of the commodity in WHO recommendation, how it is indicated, and the major condition that the commodity would be used for. So this could help implementers, could help countries to because they are long list. Another issue of the convening meeting, that is, you cannot have a reduced list of 5 commodities, 6 commodities, because all are important, and having a complete list would help implementers to decide according to the burden of in the regions to select or to prioritize which commodities are needed to be scaled up, prioritized, etc. And in the right part of the slide, you can say the same list of neonatal commodities, but in this case are grouped according to the level of care, the community level 1 or level 2 of care. So the next steps are to disseminate this list widely, supporting countries to introduce and scale up the maternal and newborn health commodity through the EWIN country acceleration plans, update the list of this list. It is a long list, but this need to be regularly updated according to new WHO recommendations or to new updates of existing WHO recommendations, and also add the child health commodities to this maternal and newborn list. So thank you very much.
Thank you so much, Dauda, for a very informative presentation. And we believe that our webinar attendees have learned a lot on your presentation. And thank you so very much again, Dauda. So kindly let us proceed to the next agenda. Before the second agenda, I would like to introduce you with a brief biography of our speaker. Madam Sacha Bootsma has been the public health professional with 25 years of work experience in humanitarian aid development, cooperation, emergency preparedness and response for both WHO and Red Cross in South America. Red Cross in South America, the Caribbean, the Middle East, Horn of Africa, Central Asia, East Asia, and Southeast Asia. She is currently serving as the International Health Cluster Coordinator with the WHO Myanmar. So, dear Madam, the floor is yours. Thank you so much, Madam. Yes. Ms. Sacha.
Thank you, Shinde. Mingalabar.
Can
you see my slides?
Yes, we can see your slides.
Thank you, Shinde. Right, you can see them? Great. Thank you. Appreciate it. Okay. So, a bit of a different presentation from Dr. Edgardo, but not so specifically focused on maternal and child health, but on the overall kits that the WHO has available for health cluster partners. And one thing is, of course, the fact that the WHO has these kits available. The second is the discussion about how to actually get them to our health cluster partners in the Myanmar context. I'll touch upon that in a little bit. But first, important for partners to understand what types of kits are actually available. And that obviously all the medicines, the supplies inside those kits are in line with the WHO essential medicine list. So these are all high quality medicines. And that is obviously in the Myanmar context something which is highly desirable, because we know that the biggest challenge we are having in Myanmar is currently the lack of good quality pharmaceuticals for local procurement, because there is no such thing as a pre-qualified list of suppliers in Myanmar. So it's really challenging for partners to procure good quality drugs. So these kits, in principle, would form a fantastic alternative for partners, because we know that the quality of the supplies in those kits is of very high standards. Also, the kits are in line with the treatment protocols, in line with the latest WHO guidance, which is available. Every 4 to 5 years, so recently, late last year, the contents of these kits is revised to ensure it is adjusted to the most recent treatment protocols, and also a lot of feedback that partners are giving to WHO on the usefulness of the contents of these kits. The most of these WHO kits have 2 suppliers. I'm not supposed to name them, of course, but they're IDA and MEG. They're big suppliers based in not in Asia, the content is the same, but sometimes the content a little bit different in terms of the packaging. WHO has a massive warehouse in Dubai from where we can, or WHO can then send those supplies to where they are needed or requested. So one of the key issues which is important for partners to be aware of what types of kits are available, as I mentioned earlier. This is actually all available online on the WHO website. So we have lots of acronyms. So unfortunately, that is the reality that we deal with. Terrible acronyms, but once you get to know them and you work with them on a daily basis, you start to understand and grasp that it's definitely easier to use the acronym than the full name, because the IAHK is the Intra-Emergency Health Kit, and it's definitely easy to say IAHK. TESC is the trauma kit. The trauma kit, of course, is also easy. NCD kit. So anyway, the different PET-SAM kit, Dr. Ninvini will discuss the PET-SAM kit later, which is for medical complications of severe acute malnutrition for children. We have measles kits, collection, testing and transfusion kits. Anyway, many different types of kits that are available. But the most important ones and the most popular ones with partners is the famous IAHK. So the basic emergency health kit for WHO. I shan't go too much into the detail because I know the biggest challenge that we are facing in Myanmar is actually how to get those kits to our partners on the ground. But anyway, this is the most popular kit. It contains everything that can actually be used in early phases of an emergency, but also in the case of Myanmar, where we simply do not have access to pharmaceuticals. So this is really allowing mobile health teams, but also static health facilities that otherwise do not have access to quality medicines to get that, the basic supplies when it comes to the treatment of whatever types of conditions that the health workers are seeing in the field. So the full kit is designed for an outreach population of 10,000 for a period of 3 months. I mean, there is a few conditions there. It says it's not designed or recommended for resupplying of existing healthcare facilities, but in reality, that is actually exactly what it is used for, because no alternative sources for pharmaceuticals are usually in situations like in Myanmar available. So we become basically dependent on those kits. So this is just a graph to show what types of contents are in the kits. Oral rehydration salts, for example, for cholera, AWD outbreaks, IV fluids, but also surgical instruments, antibiotics, antiseptics, and then some supplies like aprons, stethoscopes, safety boxes for use, syringes. So it's a very comprehensive kit and extremely useful, we know, because partners in many countries in the world in emergency settings are usually very happy and content with these IAHK kits. So it has a basic module, it has a malaria module. I shan't go too much into the detail, but just for you to see that it really is built up of several types of units and modules. Controlled medicines, cold chain medicines can all be requested separately. There is a PEP unit, prophylaxis for exposure. And the malaria unit, as I mentioned. Just to show here once again that is for primary healthcare, but also for hospital care use. That is the IAHK. Right. A lot of data there. I will share the presentation later so people can check about the details of what is the content of these kits and what it is meant to serve and treat with one unit or one kit. So there is the PEP module is also a new module, post-exposure prophylaxis. That was the full name of the acronym. Once again, it's been recently updated based on the updated recommendations of the treatment protocol. NCD, so that's a separate kit that can also be requested. Yeah, there you go. The PATSAM kit that Dr. Ninmidi will further cover in her presentation. Measles kit, I mean, of course, the biggest challenge that we're currently having in Myanmar is our inability to actually detect measles because of a lack of comprehensive surveillance system, lack of laboratory capacity. But nevertheless, for the treatment of severe and mild measles cases, there is the measles kit available. We have a combined PATSAM, so I had a pediatric kit for the treatment of medical complications for children with severe acute malnutrition combined with measles. So there's all kinds of really very specific kits available for treatment of conditions that we are all seeing currently inside Myanmar. Pneumonia is another typical condition that we are in need of properly treating. The cholera kit, what we are seeing in Myanmar at the moment, quite a large number of acute watery diarrhea kits that we don't always know whether it is cholera, again, because of the lack of laboratory capacity. But nowadays in Myanmar, when we see an increase in acute watery diarrhea cases, we are treating it as if it is a cholera outbreak in terms of response interventions. However, the difficulty remains, the challenge remains with getting the kits on the ground. And that is really, I'm just browsing through the slides because I don't want to go into the details, as I mentioned, because it will take way too much time. But important, once again, for partners to be aware what types of kits we have available as a WHO. Trauma kit, also extremely, should be in principle in high demand in Myanmar under the current circumstances where we are seeing a lot of conflict situations and a lot of injuries as a result of active conflicts. That kit is shared with ICRC, the International Committee of the Red Cross, that has similar kits available. They're using a different name for it, but we are calling it the TESC, or the Trauma and Emergency Surgery Kit, that will really help skilled health workers, though, with the treatment of injured people as a result of trauma. Yes, just say, well, there is the different colors of the labels. I don't really think it's that relevant. As you can see, this presentation comes straight from the WHO headquarters, the logistics department, who were supposed to do this presentation in the first place. But I think what would be good to highlight is the challenges. I mean, so we will share this presentation with you. All this information is available online on the WHO website. We'll share the link with you later in the chat. How do we get those kits to our partners? In Myanmar, this is extremely difficult because of the fact that importation of these kits is strictly controlled by the de facto Ministry of Health. That means that delivery of these kits within Myanmar is done through the de facto Ministry of Health. So meaning it is very challenging or almost impossible to actually distribute to the health cluster partners directly. Only if and when township health authorities are in agreement with partners' request for these types of kits, and the use of these kits. Are these kits then can we deliver them to the partners through the township health authorities? So always health authorities will have to be involved in the last mile delivery of those kits to the partners. We're looking at other ways to support partners, particularly through that warehouse in Dubai. but this is still work in progress. It is definitely in the Myanmar context extremely challenging to ensure that our partners are receiving these life-saving emergency medical supplies that are readily available for partners. If only we would have the possibility to, as in other countries, deliver them directly to our partners, that would make life so much easier, particularly, as I mentioned earlier, and what you all know much better than I do, with the difficulty of procuring good quality drugs inside of Myanmar. That is also currently not specifically possible. With that, I would like to finish my presentation. I'll share with you the link and later the presentation. Many, many thanks.
Thank you so much, Ms. Sacha, for sharing such a useful information. We hope that our webinar attendees are now know the overview of the various WHO health emergency kits, and thank you so much again for discussing specifically for the Myanmar context and your contribution to the Myanmar. And thank you. So let me move to the next agenda. Before the next agenda item, may I introduce you to the brief biography of our third speaker, Dr. Tomoko Kurokawa. Dr. Kurokawa is the Regional Humanitarian Advisor at the UNFPA, Asian Pacific Regional Office. She is a physician and public health specialist with over 15 years of clinical, academic, and humanitarian experience. Before joining the UN, she worked with the MSF and other international NGOs, leading humanitarian responses in disease outbreak, natural disasters, and post-conflict settings. In her current role, she strengthens disaster risk reduction strategies that integrate the SRHR and GBV prevention and response. So, dear Doctor, the floor is yours now.
Great, thank you so much, and I hope everybody can hear me well. So my name is Tomoko Kurokawa, and I work for UNFPA. Thank you so much for having me today. And I will be introducing the Interagency Reproductive Health Kits for emergency settings. Next slide. Great. So in any disaster setting, women and girls of reproductive age, which means 15 to 49 years old, make up around 25% of an affected population. So these 25% of the affected population will need access to information and services related to sexual and reproductive health. And at any time, approximately 4% of a crisis-affected population will be pregnant. And about 15% of these pregnant women will likely experience complications that will require urgent medical attention. So these complications may include severe bleeding, infections, eclampsia, or obstructed labor, all of which can be very life-threatening without access to emergency care. As we know, in crisis settings, disruptions in healthcare access, supply chains, and lack of trained personnel can mean delayed or denied access to critical life-saving sexual and reproductive health services, and then this can increase the risk of preventable maternal and newborn deaths. We know that lack of access to and availability of contraceptives and treatment for sexually transmitted infections and HIV can also lead to negative outcomes, including unintended pregnancies and a rise in STI and HIV infections. And also, during crises, we know that the risk of gender-based violence, including sexual violence, can also increase because of breakdown of social protection systems and various other factors. So this is why ensuring immediate access to life-saving sexual and reproductive health services is absolutely critical. Next slide. So many of you may be familiar with the Minimum Initial Service Package, or the MISP, for sexual and reproductive health in crisis settings. So this is a minimum set of life-saving interventions for use in the early phases of any crisis. It's a coordinated set of activities that must be implemented immediately at the onset of a crisis, even when medical facilities are disrupted or absent. The MISP is designed to prevent sexual and reproductive health-related morbidity and mortality, while also upholding the right to life with dignity for affected communities. The MISP is essential because it ensures continuity of essential life-saving sexual and reproductive health care, because we know that neglecting these needs leads to serious consequences. Again, what I mentioned before, preventable newborn and maternal deaths, sexual violence and trauma, unintended pregnancies, where then, after that, women and girls may seek unsafe abortions, and also the spread of HIV and sexually transmitted infections. The 6 core objectives of the MISP include, first, identifying a lead coordination agency for the SRH working group or for the MISP. The second is preventing and managing sexual and gender-based violence. The third is reducing HIV transmission and providing syndromic treatment for sexually transmitted infections. The fourth objective is preventing excess maternal and neonatal morbidity or mortality. The fifth is ensuring availability of contraceptives. And the sixth and final objective is planning for the provision of comprehensive sexual and reproductive health services as soon as the situation permits. I want to note that the MISP is a globally recognized universal minimum standard for emergency response. It is integrated into the SPHERE minimum standards and the Global Health Cluster guidance. And it's one of the CERF, the Central Emergency Response Fund minimum life-saving criteria. Next slide. So the interagency reproductive health kits were designed to support the implementation of the MISP. So the reproductive health kits help health actors respond quickly by providing essential medical supplies, drugs, and equipment for a 3-month period, and it's designed to serve a specific population size. These kits are pre-packaged, standardized kits that minimize delays in emergency sexual and reproductive health response. So in this slide, you will see the MISP 6 objectives, and the small colored circles that you see at the bottom of some of the boxes represent the different reproductive health kits that are aimed to support the specific clinical MISP objectives. So later I will paste a link to this document. We call this document the MISP cheat sheet. Next slide. So the interagency reproductive health kits are structured into 3 blocks, and each is designed to support a specific level of health service delivery in crisis settings. Every kit is designed to be used by trained health personnel, ensuring safe, effective, and high-quality sexual and reproductive health care in emergency settings. Some kits can be used by community health workers, while others require specialized medical professionals to ensure safe and effective care. These kits align with global best practices and are regularly updated about every 4 to 5 years based on feedback from field users, based on emerging medical guidelines, and also lessons learned from its application in the field. So again, the kits are organized through a 3-block system. Each block contains specific kits tailored to the service level and also the MISP objective. So block 1 is for community level health posts. It is designed to serve 10,000 people for 3 months and supports safe delivery, STI prevention, and also family planning. So the kits that are included in block 1 include male condoms, clean delivery kits, post-rape treatment kits, oral and injectable contraceptives, and also medicines for syndromic treatment of sexually transmitted infections. Next slide. And then block 2 is for primary health care and basic emergency obstetric and newborn care facilities, or what we call BMONC facilities. So this is intended for health centers with midwifery services to manage uncomplicated births and basic obstetric emergencies. So each kit in block 2 is designed to serve a population of 30,000 for up to 3 months and includes supplies for assisted deliveries and post-abortion care. So the kits that are included in block 2 include clinical delivery assistance kits, which are separated by both reusable equipment and another kit that includes drugs and disposable equipment. And then other kits support management of complications of miscarriages or abortion, surgical repair of cervical and vaginal tears, and also vacuum-assisted deliveries. Next slide. And then the third block is for comprehensive emergency obstetric and newborn care, or what we call CMONC. These are for referral level hospitals that have the capacity to conduct cesarean sections and neonatal resuscitation. So each kit in block 3 is designed to serve a population of up to 150,000 people for 3 months. It includes cesarean section supplies, blood transfusion kits, and other emergency obstetric care tools, drugs, and medicines. So these kits support delivery of obstetric surgeries and management of severe obstetric complications and also blood transfusions. Next slide. So I'm going to show you a photo of each of our kits just so you have a better idea of what the contents are. So kit 2A is an individual clean delivery kit. It's designed for pregnant women who may have to give birth at home or in non-medical settings. It contains basic but essential sterile supplies to ensure a clean birth and to prevent infection-related complications. So key items include soap, a clean delivery sheet, sterile umbilical cord scissors and cord ties, a plastic bag for waste disposal. And again, this is for where women may not be able to travel to a delivery facility because of poor access or inability to travel, and who may need to deliver at home. Next slide. And then to complement this, there is kit 2B, which is a clean delivery kit meant for support for skilled birth attendants. So this has to be used by trained health workers assisting in home or community-based deliveries. It includes everything in kit 2A, but adds extra items to protect both the birth attendant and the newborn. Next slide. So the key additional items in 2B are a flashlight, because many of the midwives or skilled birth attendants might have to deliver at night. It also includes sterile gloves, a plastic apron, surgical masks, and also an additional sterile cord clamp for better cord care. Next slide. Kit 3 is the post-rape treatment kit. So this provides urgent medical care for survivors of sexual violence. It ensures that survivors of sexual violence have access to critical medications and support within the recommended 72-hour window. So it includes post-exposure prophylaxis to prevent HIV transmission. It includes emergency contraception to prevent unintended pregnancy. It also contains antibiotics for STI prevention, pregnancy test kits, and psychosocial support materials. So this kit must be administered by trained health workers who can provide confidential and survivor-centered care. Next slide. Now, kit 4 ensures that women in crisis settings can access contraceptions to prevent unintended pregnancies. So it includes oral contraceptive pills, injectable contraceptives, and also emergency contraception. So this kit also contains syringes, needles, alcohol swabs, and cotton wool to be able to properly inject the medroxyprogesterone acetate. It also comes with a family planning guidelines so that health workers can counsel women on informed family planning choices. Next slide, sorry. Kit 5 is for the treatment of sexually transmitted infections. So it ensures access to essential medications for syndromic treatment of common STIs. So this includes benzathine penicillin for syphilis treatment, azithromycin and cefixime for gonorrhea and chlamydia, metronidazole and clotrimazole for vaginal infections, and also male and female condoms for prevention of STIs. So this kit is designed to support health centers, but also mobile clinics. Next slide. Then we have kit 6A. This is the clinical delivery assistance kit. And the A version, 6A, as opposed to 6B, includes reusable equipment for safe childbirth. So key supplies include delivery sets that include scissors, forceps, clamps, and umbilical ties, It also includes a mechanical stopwatch to assess newborn breathing. It has newborn resuscitation equipment, and also sterile instruments and gauze for care of wounds. So this kit is designed to be used by skilled birth attendants and midwives so that they can assist in deliveries and basic newborn care. Next slide. And to complement this, you can separately order Kit 6B, which includes drugs and disposable supplies. So this includes drugs like oxytocin to prevent postpartum hemorrhage, antibiotics for infection control, and magnesium sulfate for treating preeclampsia. Next slide. Also includes IV fluids, sterile gloves, and syringes. So again, this kit is critical to manage common delivery complications and ensuring maternal survival. Next slide. So Kit 8 is for women who are experiencing miscarriage, incomplete abortion, or other pregnancy-related complications. So it enables effective management to prevent sepsis, hemorrhage, and death as complications of miscarriage or abortion. So the key supplies in Kit 8 include misoprostol for medical management of incomplete abortion and miscarriage. It also includes a manual vacuum aspiration kit for safe surgical management of incomplete abortions. It also includes antibiotics, pain management drugs that include paracetamol and ibuprofen, and also sterile gloves, gauze, forceps, and antiseptic solutions. Now, again, this kit should only be used by trained healthcare providers. Next slide. Then Kit 9 is to treat severe birth-related injuries such as cervical and vaginal tears, which, as we know, if left untreated, can lead to excessive bleeding, infections, and other long-term complications. So this kit includes surgical supplies like sutures, both absorbable and non-absorbable, for repairing the tears. It also includes forceps, scissors, and retractors, local anesthesia, which is lidocaine in this case, antiseptics and antibiotics, also sterile gloves, gauze, and syringes. Next slide. Then we get into the block 3, which is for CMONC facilities that are referral level hospitals. So Kit 11A includes reusable equipment, which includes scalpels, retractors, forceps, scissors, and sutures, and other surgical apparatus that are needed to conduct cesarean sections. So it includes also sterile drapes, gloves, and gauze to be used during the surgery, and suction devices for surgical use. So this, as you can imagine, should only be used in referral level hospitals with trained surgeons so that they can ensure safe management of complicated obstetric emergencies. Next slide. Then Kit 11B is the complementary kit that includes medicines and disposable equipment. For example, anesthetics like ketamine, lidocaine, ephedrine. It also includes tranexamic acid to control postpartum hemorrhage. It includes IV fluids, blood collection bags, and also antibiotics for post-surgical cares. Okay, next slide. And this includes just some more photos of Kit 11 with the IV bags and other medications and supplies. Next slide. And finally, we have Kit 12, which is the blood transfusion kit. This is essential for hospitals that must treat hemorrhage and severe anemia due to obstetric complications. So this includes blood collection bags, transfusion sets, and IV catheters. It also has rapid test kits for HIV, hepatitis B, hepatitis C, and syphilis. It includes sterile gloves, alcohol wipes, and anticoagulants. Next slide. And there are also complementary kits and supplies that can be ordered for additional management of labor and to provide broader range of contraceptive options. So complementary kits include an administration and training kit for SRH coordination, training, and monitoring. It also includes female condoms, chlorhexidine gel, which is important for newborn umbilical cord care, misoprostol to manage postpartum hemorrhage, where oxytocin may be unavailable, DMPA-SC, this is the subcutaneous self-injectable contraceptive to provide long-term pregnancy prevention, a copper IUD, subdermal contraceptive implants like levonorgestrel, the brand name is Jadel. You could also order complementary non-pneumatic anti-shock garments to manage obstetric hemorrhage and to prevent maternal shock. You can order additional oxytocin. You can also order handheld vacuum-assisted delivery systems and also mifepristone for medical abortion where it is legally permitted in the country. Next slide. So the photo on the right, that is the current Interagency Reproductive Health Kit Manual. This is a comprehensive guide that details the contents and the intended use of each of the reproductive health kits that I introduced. It also introduces the volume and the size of each of the kits. And this is absolutely critical for logistics planning, for transport and storage requirements, because each kit can come in a range of different boxes. For example, the clean delivery kit from block 1 may come in just 1 or 2 boxes. But as you can imagine, some of the CMONC kits from block 3, like 11A and 11B that are to be used in the referral level hospitals, when you order one of those kits, it may actually come in up to 50 or 60 boxes. So this manual guide, it also helps you to identify the right kits and helps you to also calculate the right quantities that you will need for the different objectives of the MISP. And also it provides guidance on proper handling, storage, and deployment of the kits, because there are many kits that include keep cool items like oxytocin. Right now, this manual is the current updated one, but it was developed in 2019. But last year in 2024, UNFPA led a global multi-stakeholder consultation to update the kits based on new medical guidelines and treatment protocols, also feedback from humanitarian field responders based on their actual application of the kits, and also evolving global best practices for reproductive health in emergencies. So as a result, the contents of many of the kits will be revised to reflect the latest evidence-based approaches. And this new edition of the Reproductive Health Kit Manual is expected to be released either this year or next year. So at that time, UNFPA and also our sister agencies, WHO and UNICEF, can share these with the different partners. Just note that UNFPA is the global custodian for the interagency reproductive health kits. And anybody, any partner, any agency can order reproductive health kits through UNFPA. So if you are interested, please reach out to your UNFPA counterpart in Myanmar. And for this too, I will also put in the chat box the link to the Interagency Reproductive Health Kit Manual. Next slide. Thank you so much. I'll be available for any questions. Thanks.
Thank you so much, Dr. for a very insightful presentation, and we are confident that all our participants now have a clear understanding of these reproductive health kits for use in the emergency settings. And thank you so much again, Dr. And let me go on to the fourth presentation. The fourth presentation will be shared by 2 honorable speakers from the UNICEF. Kindly let me introduce a brief biography of them. The first speaker, Dr. Shaimaa Ibrahim, is the health specialist, MNCAH UNICEF headquarters. She is the MNCAH specialist with clinical background in OG and has more than 15 years of experience in reproductive, maternal, newborn, child, and adolescent health programming. In her current role, she is supporting and coordinating the several global technical activities along with other UN agencies, WHO and UNFPA, for improving MNCAH with a focus on countries with high burden of maternal and newborn mortalities and stillbirths. The second speaker will be Madam Louise Enevoldsen, the technical specialist, Center Health Emergency Strategy and Partnership, UNICEF Supply Division. She specialized in medical countermeasures for public health emergencies, including medical devices, PPE, and health kits. Louise is based in Kenya, where she is supporting UNICEF localization agenda to build up manufacturing capacity in the African continent. So with heartfelt thanks for agreeing to support us for today's webinar, I would like to invite dear speakers from the UNICEF to share their presentation. So dear Dr. Ahmedan, the floor is yours now.
Can you share? Yeah, our presentation. Thank you so much. Thank you so much for inviting UNICEF to participate in this webinar. Now we will talk about the newborn kit, which is an interagency emergency health kit for the newborns, and it will be joint presentation by me and my colleague Louise. Next slide, please. So the newborn supply kit for humanitarian setting, I will give a brief introduction first about the background on kit development. We all know that the neonatal period marks one of the most vulnerable periods in the life cycle, the first 28 days of life. And especially in conflict and emergency settings, this vulnerability increases with limited access to services. And actually, highest neonatal mortality rate usually found at the time of humanitarian crisis. And we need more attention and focus to ensure that the newborn needs are adequately addressed as part of any crisis response and any emergency. So we will discuss here two main actually global guidance that are interrelated. The Newborn Health Field Guide in Humanitarian Settings, and this field guide developed to provide a technical guidance on the newborn care in emergency and to serve as a program management and advocacy tool. And this is a joint actually guidance that is developed and published by all relevant UN agencies, logos with the Save the Children as well. And then we will discuss the newborn supply kit, which complement the IARH kit for humanitarian setting that was developed to provide full range of supply equipment and drug to support the implementation of priority and essential newborn care services. And this actually, the newborn supply kit, it gives the essential services. It does not go into the more advanced newborn care, which is difficult to support at time of emergency. Next slide, please. So let's start with the newborn health field guide to have an idea about it. It provides information related to the newborn care and tools that support the implementation of a good quality newborn services in humanitarian settings that are required to reduce both mortality and morbidity for the newborns. It includes technical guidance for the newborn care centered around preventing the main causes of a newborn mortality, which is, in summary, the preterm birth, the complications around the intrapartum complication that causes asphyxia, and neonatal infections. These are the main three causes. And also it outlined the newborn services by the level of care and what are the required commodities that should be available. And there's illustrations of these commodities by the end in the annexes. And actually it supports program design of services, whether these services delivered by UN, NGOs, or these are supported by the local health authorities. It can be used by both. So it's developed essentially for the designing, managing, and monitoring and evaluating newborn services by any health or sexual and reproductive health coordinator, general program staff, or any responders at the time of acute emergency especially. Next. So the newborn field guide actually is considered as companion to the Interagency Field Manual on Reproductive Health in Humanitarian Settings and the MIS package. So all these guidance complement each other to ensure that we have adequate guidance and support to those who are frontline workers to deliver the essential services in an integrated manner to the mothers and their newborn. It prioritizes critical health services and supply to prevent and manage, as we have said, the three main causes of newborn death and by level of care. The guide includes background, epidemiology, evidence summary, why these interventions are essential, how we could implement them, how we could do supervision and monitoring and evaluation. And in the annexes, as I have said, the newborn kit is available that include all the essential medicine and supplies by level. And actually, this guide covers the essential newborn care for the management, for example, of the low birth weight and preterm, the guidance to how to deliver kangaroo mother care in emergency setting, how we can deal with infections, intrapartum complication, and asphyxia related to these complications, how we could have a good referral system, and how we can conduct home home visits for the newborn, which is essential requirement by community health worker in such setting. Next. And now we will come to the newborn kit and what are the principles behind these kits when developed. The kit designed for use in the acute phase of emergency. In the early phase, it is not recommended for resupplying existing services or existing facilities. Some of the newborn kits are designed for use only by qualified and trained health personnel, and this is included within the modules that where we should have by level of care, what are the level of skills required to be available for the use of these kits. Actually, ordering should be based on the findings from a situation analysis in any emergency context. It's critical to confirm and to do such analysis to know what are the kits needed, which type, how many of them are required, and where they are needed, the distribution of these kits. And we have to emphasize that the newborn do not provide supply to address all the newborn needs, as I have said, not for the very advanced, but it includes the supply, medicine, and equipment to address every newborn health needs, the essential newborn care. And it is always we have to address that is complementary to the RH kit, which provide additional supply for maternal and newborn health care. Next. So the newborn kit consists actually of 3 kits organized by level of care. The community kits, 3 kits, that usually can be used to serve a population of 10,000 for 3 months. The clinical kits, clinic kits, which is for primary health care facility or a clinic with a target population serving of 30,000 for 3 months. And the hospital kits, which start with a target population of 150,000 and can be used for 3 months. Next. And this summarizes the kits in types and what are the modules available in these kits. Whether the community, we have 2 parts, part A and B. The first part is for the family care, and the second one to be used by community health workers and include medicine and equipment. And we have as well the clinic or primary health care facility kit and the hospital kit. Both of them are composed of 5 modules for medicine, consumable, medical equipment, cloth and accessory, and malaria. Next. Now we will come into some details about each type of the kits. So the community newborn kit for the community, we have 2 parts, the family and the community health worker kits. The family care kits to be distributed to pregnant women, while the community health worker to be used by those frontline workers. Both parts are containing user instructions, educational material for the end user beneficiaries, and the target population, as I have said, for 10,000 people. and for 3 months. The family kit, actually, it is designed on the assumption that in the 3 months, the population of 10,000 with a crude birth rate of 40, it consists of 100 individual packages to be distributed to the women. And these should be distributed directly to women, either at the time of labor or at least in the 3rd trimester of pregnancy. And their distribution must be aligned with the antenatal care visit. So usually at the time of humanitarian crisis, there is a mapping of the camp settings, the population there, with the estimation of the people who are, of the women who are around the time of birth for these to be distributed. And we have to always consider that the use of the kits to be aligned with the interventions delivery. What are starting from the antenatal care, the birth, then the postnatal care. Next. This is the part B, which is for the community health worker kits, and it is designed to be used by 10 community health workers who are serving these 10,000 population. It is considered as complementary to the RH kit 2B that contain the supply for the birth attendants, such as mentioned by my colleague from UNFPA, the flashlight, the plastic apron, and includes actually 2 modules for medicine and equipment. Next. Next slide, yeah. Now we will go to the clinic or the primary healthcare facility kit. No, please, yeah. The content of these kits, it support the delivery of interventions for the essential newborn care for uncomplicated live birth. And we all know the essential newborn care should be delivered to every newborn. It supports the provision of newborn resuscitation to stabilize the newborn with serious infection prior to referral, and to care of the preterm baby at the level of a clinic or primary healthcare level. So each kit, as I have said, it is designed to support the delivery of essential intervention by this level of care. It should be used by a trained personnel, whether they are midwife, nurses, and medical doctors, and the target population for one facility serving 30,000 population for 3 months. And the assumption behind that we will have 300 deliveries will occur in this 3 months with the crude birth rate estimates of 40. And it contains 5 modules for medicine, consumable, medical equipment, clothes and accessories, and the malaria module. And we have to say that these modules, it could be ordered separately and in different quantities. And my colleague Louise will also give more explanations and instructions about this. And it is considered as complementary kit to the RH clinical delivery kit 6, which includes supply that support labor and delivery. We have to also say that this captures the deliveries at PHC and primary level, but it does not consider the community delivery. Next, please. The other one is the hospital newborn kit, which is used to deliver intervention and support the implementation for the treatment of a newborn infection, to provide a newborn resuscitation, to provide care for the preterm babies with complications at the referral level health facilities or hospitals. It should be used by also trained personnel, whether midwife, nurses, or medical doctors. And the target population that's serving is about 150,000 for 3 months, with the assumption that the crude birth rate of 40, as we have said. And also it includes assumptions of the expected estimate of complication, such as 18% estimates of the preterm or low birth weight newborn, and around 20% of them, they might develop complication as well. and 10% of the newborns, they might develop infections. With 1% of them, they might develop severe infection, for example. So these are estimates and available percentage of suspected, let's say, complication that could be covered by delivery of the interventions and what the use of these kits. And the complementary IARH kit, it's for referral, and it complements the kits of 11A, 11B, and 12. And it anticipates the occurrence of 1,500 delivery at the hospital level, and it does not capture the deliveries at the lower level, whether it's PHC or community level. And it contains as well 5 modules for medicine, consumable, equipment, clothes, accessories, and malaria. And all of them, as I have said, can be ordered separately. And each modules in that kit cover approximately about 50 to 60 newborn complications. And to order the 5 modules will cover 150,000 population for 3 months. Next. Now I hand over to my colleague Louise to give us the overview about the process of procurement. Thank you.
Good afternoon, colleagues. Once again, warm greetings from Nairobi. My name is Louise Enevoldsen, and I'm a technical specialist at UNICEF Supply Division. I'm going to very quickly walk you through how you can order health kits and individual items from UNICEF. So what you are seeing at this slide is actually a picture from our humanitarian warehouse in Copenhagen, which is the largest humanitarian warehouse in the world. And this is where all our health kits come from. So from UNICEF, you can order the newborn kit that Shaimaa has just walked you through, but you can also order the Interagency Emergency Health Kit, which is an interagency kit shared with WHO and MSF. And you can actually also order some of the reproductive health kits that are shared with UNFPA. So in particular, the clean delivery kit, the midwifery kits, and the obstetric kits.
Thank you.
So in order for external partners to order through UNICEF, they will have to go through what we call UNICEF procurement services. So UNICEF undertakes procurement on behalf of governments, UN agencies, NGOs, and other developing partners. We do, however, not procure on behalf of individuals or profit-making entities. So why do we procure on behalf of partners? We do this to allow partners to access our supply expertise to procure essential supplies, quality assured, and affordable supplies for children. So we have 2 different procurement channels. So if you are a UNICEF country office, you can go through the UNICEF internal system, use UNICEF funding to access program supplies and services, procure them, and then hand them over to implementing partners. If you are an external partner to UNICEF, you will have to go through our procurement services center, establish an agreement, procure it via that, and then most likely also hand that over to the selected implementing partners. So there are 6 steps in the procurement services process. The first 3 steps are planning, cost estimate, and commitment. And these 3 steps can be done in parallel while establishing a memorandum of understanding. So there has to be an MOU in place between the partner and UNICEF. For many partners, such an MOU already exists. I think a couple of years ago, we had 140 different MOUs in place, so it's very likely that this already exists. So the first step is, of course, to identify which supplies the partners need. And this can be done via the UNICEF supply catalog, which I'll show you in the next slide. Once you've agreed on the needed supplies and the quantities, UNICEF can issue a cost estimate, which is an estimation of the cost for both the services and the freight. And then we will need a fund commitment. So once we've received commitment of funds and actually receipt of funds, we can go on to step 4, which is procurement and delivery. We can then use our already established contracts with suppliers to buy the needed supplies. If it's kits like we're talking about today, many of these will most likely already be available to ship from our warehouse. And then we deliver them in accordance with the agreed upon terms. Then after delivery, we settle the account. So sometimes you incorporate a buffer of funds to cover unforeseen costs. So if there's such a buffer, this is of course settled and paid back to the partner. And if the partnership includes M&E activities, monitoring of the supplies, this will also be conducted as part of step 6. All PS requests has to go through the email address that you're seeing in the right bottom corner, psid@unicef.org. And this is where our procurement services colleagues will take good care of you. And this is just to show you what the UNICEF supply catalog looks like. So you can go to www.supply.unicef.org, and then it will take you to this page. Here you have a few options. You can search for individual materials, which you will see on the search function on your right. So you could put in a glove or coverall or IUTF. Or you can use the drop-down menu on the left, where you can, for instance, choose kits, and then you will see all the different kits available from UNICEF. What you will see under each product is, of course, the content, if we're talking about kits, but if it's an individual product, you will also see the product specifications, the product standards, the regulatory frameworks, etc. So this is a good place to find all the information that you need. Thank you.
Thank you so much for a very informative presentation, and a sincere apology for the inconvenience because of some issue. It was a very good and useful to learn about these UNICEF Interagency emergency health kits for the newborns. So kindly let me move to the next agenda. So for the last but not the least of the today presentation, I would like to introduce a brief biography of our speaker, Dr. Namini Hemantchandra. Dr. Namini is the team lead for the Reproductive, Maternal, Newborn, Health and Adolescent Unit at the WHO Country Office, Myanmar. She is a medical doctor specializing in community medicine and has more than 25 years of experience in the field of reproductive, maternal, child and adolescent health, with 9 years of experience in the WHO. So dear doctors, the floor is yours.
Okay. Thank you, Shinle. So may I share this presentation from my side? See? Can you see? In the presentation mode? Okay. So I will quickly go through the WHO PAD-SAM 2020 kit. This is a that we pass through the general health kits, the specific kits, and then the reproductive health kits, and then the newborn kits, so that now move to the pediatric kits. So PD means the pediatric, SM means the severe acute malnutrition. So this kit contains that the commodities you need to manage the common pediatric illnesses and severe acute malnutrition with the medical complication children. This kit intend to provide medicines, renewables, and equipments need to treat sick children, including severe acute malnutrition with medical complications at hospital level. So but this content of each module need to be handled by the trained professionals, and some standalone modules may be used for primary health care or mobile clinics. So unfortunately for this in this kit, there is a no module for the community use. This module PAD-SAM contain of earlier it was 6 modules, but now it has 8 modules because that they add they separate that the kids with the equipments to as a 7A, 7B, and 8. We will go through that one by one with some details. It's module 1. It's it's contain medicine for severe management of severe acute malnutrition with medical complications. So it can, that the medicines is enough to treat about 50 SAM MC children. Earlier, the dextrose was not there, and then the dexamethasone was not there. So now that these two medicines was included with the 2020 revision. But this module does not contain any HIV, TB, or anti-cancer medicines or food and therapeutic milk. So because whenever that someone is looking this SAM word, so that everyone is thinking that it will contain food or therapeutic things for the milk or the supplements. It's not, it doesn't contain those things. That this module is only used by healthcare providers working in hospitals or stabilization centers, where that the staff have trained to appropriate manage of severe acute malnutrition with medical complications. The module 2, this module contain that oral and the topical medicines which are commonly used for pediatric ward for the treatment of major common pediatric illness as per the WHO Pocket Book of Hospital Care for Children. So this module is sufficient to 10-bed pediatric unit for about 3 months or for an outpatient department or a mobile clinic. This module also does not contain any HIV, TB, or anti-cancer medicines. The module 3, it contains medicines, the pediatric injectables. So this one also supposed to use in a hospital, and it contain IV fluids and IV fluids. So that this also sufficient for 10-bed pediatric unit for 3 months duration. Module 4, this module contains control drugs such as diazepam, morphine, midazolam, or those things. So if you need to get this control medicine module, so we need to get the import license permit from the Ministry of Health. Otherwise, this module cannot be enter the country. So for this, with this specific requirement, when you make requisitions, that you need to do the separate requisition for this module. Then module 5 contain medicines for malaria. So it contain oral and injectable medicine to treat malaria, as well as a poster to ease the reconstitution of the injectable. Then the amount of medicine in module 5 will be enough to treat 150 cases of non-complicated malaria, 60 babies and 90 infants. Then module 6, it contains supplies and renewables. So it contains gauze, bandage, syringes, IV lines, and some aprons and so on. So this module needs to be used along with the module 3. That means medicines for pediatric injectables. Then module 7 and 8. Module 7 has 2 components, 7A and 7B. So this is equipment. It contains scale, stethoscope, and hemoglobinometer, the HemoQ. So that the part A contain these hemoglobinometer, the part B only contain that the test kits for the HemoQ machine. So then it is easy to order because that if you have already have that the 7A, the next time you need to only order 7B to replenish or to be used in the glucometer. So earlier the glucometer also was with this module, but now it has a separate module. It's a module 8. The module 8. So it's a completely new module, which is also part of the cholera kit and new NCDK kit. It contains glucometer with 300 strips and 300 Lancet pens. This module can be used in pediatric ward or can be given to the one diabetic patient. So this gives, based on your requirement, that you can calculate that the number of kits that you need to order in your scenario. So that this slide gives you some examples, but I will not go with all these things because that these presentations will be shared with you all after the within next 2 days. So this is end of my presentation. Thank you very much.